back to our So Everybody Can Move Lead Advocate Call. We've moved to a bi-monthly cadence, so every other month, especially during this session when a lot of our states are working very hard through the legislative sessions and have had a lot going on. We'll continue the bi-monthly cadence at least until we hear anyone complain that we should, move to a monthly cadence again if people are wanting that. But so far, this has been pretty good to bring us all together. And I really want to start out our call today with really our why. We did this kind of towards the end of the year last year, and have kind of implemented this section where we want to be able to share the stories of impact and why it is we're all coming together as part of So Everybody Can Move and how this is impacting folks. So the first individual we have speaking and sharing their story today is Danielle Cummings. She is not new to So Everybody Can Move. She testified before a number of the committees in New Mexico and helped get the bill enacted there last year. And she's got some exciting news to share and her story as well. So I'll pass the mic over to Danielle to share, and we'll go from there.
Hi, everyone. My name's Danielle. I just have like a few little things that Nicole wanted to talk about to kind of talk about my story. But like she said, I got involved with So Everybody Could Move last year, kind of as more of an able-bodied individual. I had a really severe rock climbing accident that kind of gave me a really bad chronic ankle for a while, and I had a brace that insurance would not cover. And so I saw the needs more on the orthotic side of it. And so that was kind of my testimony there. But part of my journey to this was the brace wasn't working. I was living in severe chronic pain every day. The bone was dying, and I was faced with this choice of what we were going to do next. And I was very much considering amputation, but one of my hesitations was, what does access to prosthetics look like afterwards? How do I get active legs? What does that look like? Yes, I can amputate and potentially be pain-free, but will I actually be able to be active? And so that was kind of a lot of my testimony that I would share in front of legislative committees. And then fast forward as last year was going on, the pain was getting worse. I couldn't sleep, I couldn't eat, and I'm also in med school. And so I was trying to do all of this, and I was having a really hard time learning because of the pain. And so through talking with people like Nicole and some other individuals that I met, I finally made the choice to amputate in July. And so I've been an amputee for, it'll be 9 months and on the 7th. So very new to amputation, but it truly has changed my life. All of my pain is gone. I feel like I have so much more mobility, and I've been able to get back to sport. And I think, the bill got written into law in January in New Mexico that insurance must now approve and cover an active prosthetic, which is why we're all doing this. And I was the first person in New Mexico to get my running leg through that bill and through that legislation. And so really just a very cool full circle moment of going from one of the people testifying and just believing that movement is medicine to being the first person to get a running leg with the new legislation. And so that has been really, really exciting. And I'm really excited for like what's to come with that. And I think the biggest thing that I have learned that has made that smooth and successful is really having doctors and prosthetists and physical therapists behind each individual patient that truly believe in amputation and truly believe that every person deserves the right to an active leg. I ran into a lot of physicians in New Mexico who did not believe it that way, but my team is in Oklahoma, and they very much have met multiple times with my insurance committee. They have provided all the documentation, and so I think it's really important what we're doing on the legislative side, but I think it's also opened up potential options of just educating physicians about what amputees can do and what people with limb loss can do. And so now that I have my running leg and I'm back in the pool and I'm back cycling, I have had a few really cool opportunities come up with USA Para Triathlon, and I'm going to start racing with them this summer. So I think it's really a testament to what we're doing matters. It's important. And as everyone knows, like you can change your own life and you can change everyone's life around you. So keep doing what you're doing.
Awesome. That's amazing, Danielle. Thank you so much for sharing your story so eloquently and just hitting on all the points of this. I think it's just incredible for us to be able to see the law now going into action and the healthcare system working as it should, right? That's why we're here. We want this to be what everyone can experience. And when they get an amputation, that this is the standard of care for someone like you. So amazing what you're doing. And you'll be at AOPA's Policy Forum here in a couple weeks, right?
Yes, I will be.
Okay, awesome. So yeah, anyone that's attending AOPA's Policy Forum on April 15th and 16th, you can meet Danielle in person. So we're excited to have you there. All right,
Hey,
our
hey
next,
Nicole,
yeah,
it's
Joe.
Joe. It's Joe. Can I ask a very quick question? And Danielle, awesome to meet you. I was looking forward to meeting you at the Policy Forum. I'm on the AOPA staff as well. But you said you're in med school, and I put the comment in the chat. I just made an assumption. I don't know what field of medicine you're planning to go into, but if you have that opportunity to be a peer-to-peer, it will be just an incredible chance to share your story and share your experience with your fellow physicians. So, do you mind me asking what area of medicine you're focusing on?
For right now, I'm thinking potentially emergency medicine. Ortho is still on the table potentially. But I think in whatever capacity, whatever field I end up in, I think there will be a lot of just like really cool opportunities to inspire patients and like fellow physicians. So
Awesome. We need it every single day. So thank you.
thank you. That was a really sweet comment.
I love that. A good reminder that we can all make an impact in our spheres of influence, no matter what field we're in. Awesome. All right. And then we're going to hand it over to Robin in Wisconsin, who has just impressed me with her the fire in your heart as an advocate for your son, and would love for you to share your and your son's story and what you guys are getting up to in Wisconsin.
Hi, I'm Robin from Wisconsin. This is my 14-year-old son, Lane. Lane, can you?
Hi.
We'll share a little bit about his story and our why. We're very, very new to this, so just bear with us. Okay, well, in June of last year, Lane was riding his dirt bike in the field like he always does. And he had a little bad landing. He broke his foot. He had surgery the next day to repair the broken bone. And after that, it was just a nightmare. He had severe compartment syndrome and was flown to UW-Madison, where we were told his CK levels were really high and his kidneys could fail and they might need to amputate, and all this information was kind of just thrown at us after a broken foot diagnosis. So actually today, it's 9 months today since Lane had a right below the knee amputation, and he's come back blazing his trail, and nothing is going to stop him from doing what he did before. He is a super active teenager. He races national snowcross. He just got into dirt biking. He plays any sport he's asked to join with friends, family, brothers and sisters, runs. He just never sits still. And in the hospital, when we first found out that this was going to be his life, I made a promise to him that whatever he wants to do, I was going to figure out how to make it happen. Whatever he needed along the way, we were going to provide for him. We were going to figure it out, do research, reach out, whatever we had to do. We weren't going to say no to any of his dreams. I did end up getting a grant through Wiggle Your Toes from Minnesota for the VersaFoot, way faster than I thought, because he hopped on his snowmobile this winter with our little 5 inches of snow, and he decided he was going to race the national race in Deadwood, South Dakota in January of this year. So I spoke to Mike Schultz, who I'd contacted right away in the hospital, because I saw his story, I saw his foot, I saw what he did, and I got chills and couldn't stop crying. And I knew that I had to get this for Lane, because this was going to make a difference for Lane, and he was going to be back doing what he loves. and he did it out there on the national track in South Dakota and was learning how to ride again. It impressed everybody. The pros, his friends, me, my heart was pounding out of my chest seeing him on that track after what he'd been through and how he powered back, going to the gym 6 days a week on his own and just fighting back as hard as he could to do what he wanted. So now I guess we found out, being new to this, that he is only allowed his basic walking foot. And for a 14-year-old boy, he can't really do much with that. He would prefer to wear this Versa foot every day. He doesn't even wear that foot. And I guess my next goal for him is to get him on a blade so he can run with his brothers and sisters this summer and move and do what he wants. Because I guess we know as a teenager that the basic foot is, he's not happy with it at all. And he deserves to be back doing everything he did before. Just like any child who's injured on the track, we see it all the time, ACL tears, and they're just surgery back at it. They don't talk about their fights that they have to have with insurance because I guess there really probably isn't any. Even for the broken bones, they're healed and they have surgery and they come back. So I guess our dream and our wish for him is that's what he gets, whatever he needs to make his life work how he wants it to, and the equipment he needs to do that. So I just started looking into things and researching and found out about Limb Loss Awareness Month and this So Everybody Can Move bill. And I researched about Wisconsin. I couldn't find anything. So I think I filled out the intake form a bunch of times because I wasn't really sure where it was going. There was no website up yet for it. So I was super excited to see when the website came out. And then reached out to Sean, and we've been just getting the team started in Wisconsin. So we're
Amazing.
for lots of good things to come.
Amazing, Robin. Thank you so much for sharing that. And Lane as well. I saw that you shared your Versa foot. Thanks for putting that up there. And yeah, we're just wishing you the best and love what you're doing. I'm so excited to have you guys part of the initiative for Wisconsin. I know there's a lot of exciting momentum happening in Minnesota, so a lot of knowledge to share across states. And we've got a great leader in Sean for the state of Wisconsin. And so excited to have you too, Robin. I think that's such a great point, Lane, in you going back and competing, that, you know, it's not our community as amputees or individuals with mobility impairments. It's not that we have a lack of drive or motivation or even ability. It's that we need to have access to the care and the prosthetic care and orthotic care that we need to be at the same level as everyone else. And that's what this is all about, is our right to mobility. So thank you guys so much for sharing that story, and excited to meet you at some point in person.
Thank you. We're happy to
Yeah,
be
thank
here.
you.
Quick personal comment. Matt,
Please, Peter. Yeah.
Lane, you're a bulldog. I love what I'm hearing. Congratulations. Make it happen.
Well done.
And I want you to know how special your mother is. I had a very similar situation, 10 years old, 2 artificial legs below the knees. My mother and father said, he won't be held back at all. I wanted to do risky things. They never said no. They were fantastic. And it sounds to me like, Robin, you're just cut from the same cloth. I can't tell you how important it is to have parents like you for young people with limb loss. So congratulations and thank you for what you're doing.
Yep.
Thank you very much. Yeah, we there's no, whatever he wants to do. I know it's dangerous, but it's not my dream. It's not my future. It's his. So I can't stand in the way of it when that's his therapy and his healing is getting on those bikes and getting on those snowmobiles. So
Well done.
Absolutely incredible. And excited for you to impact even more individuals in Wisconsin with what you guys have already researched and found out. And also kudos, I know I saw Aaron on the call, kudos to Wiggle Your Toes and all they're doing to help fill the gap because of the lack of access too. So amazing. All right, we'll jump in now to our national updates. First on the list, we've got Shanice that's going to be talking about the fiscal and social impact report that has been recently published, which is exciting.
Thanks, Nicole. And I'm going to ask for some share screen ability if I don't already have access to do that, so I can share our report with y'all. But I want to start off by just acknowledging and the gratitude for everybody on this call. It wasn't long ago, the Colorado team, we experienced all the hard work that it takes to get this across the line. And it really starts with all of you and your stories. And this data is here to support you in your stories, but I can't tell you enough how important it is to speak from y'all's experience. So thank you everybody for letting me be here today. I'm going to throw the link in the chat. This is a link to the PDF version of the publication. This was published just a few days ago. And the whole purpose, again, is to be a tool for your legislators to understand what potential costs might look like. And I'm just going to jump right in. I would love this to be a discussion. So if folks have questions, please feel free to interrupt me. I'll do my best to keep an eye on the chat. Nicole, if you can help me out.
Yeah.
But essentially, I'll just start with what this report is in general. It is a multi-state analysis of the fiscal impact of commercial insurance coverage for general use and activity-specific prosthetic and orthotic devices in the United States. So essentially what that means is we're understanding what the general use cost is and the activity-specific cost is for both prosthetics and orthotics across 10 different states. It does break it down per state, and it does break it down per category, which I'll go over in a second. The PDF version is linked here. It's free. This is an open sourced journal, which essentially means there is not a cost associated with this journal and membership to gain full download ability. The impact value of this journal is just over 6.5. And what that means is on a score from 0 to 10, impact means how many people are actually looking at this magazine or this journal, sorry. A high 6 score is very high. And I do include kind of the average and the mean in an email that I've sent out to the advocates. I believe it's around 3. So essentially, that's one of the reasons why we picked this journal in short. So if you click on the PDF, and bear with me here, I'm kind of toggling through a couple of different links. The entire journal will pop up, and I want to call out a couple of items. First and foremost, I hope you guys read this report, especially the advocates that are working directly with their legislators. It just helps your understanding of the costs associated and honestly the benefit. The cost is important, but I do break it down in terms of the annual net benefit. And that's something that I want all the advocates to understand exactly what that is, because it's quite a bit per state. The category breakdown. So if you're interested in understanding in Kentucky, for example, what is the cost for just the general prosthetic cost, prosthesis cost? What is the breakdown for orthoses? And what is this altogether lump sum? This table does a really great job of outlining that. It also outlines how many devices we're estimating in each category per state, which is columns H and I. The reason I bring this up is some states throughout their negotiation, if they're needing to decrease the scope, this gives you the ability to kind of deduct what that cost would be from your legislation. Ideally, obviously, you're going for what your state needs in the entirety or the breadth and depth of this initiative. But this is found useful for a couple of the states that needed to go through that process. Any questions on this table?
Yeah, Shanice, this is great. Colleen from Children's Healthcare Atlanta.
Colleen?
Did you try getting it published in an American or US journal? Because you see this discussion of population of people in the United States, individuals, but then it's in a European journal. I review a lot of content and a lot of articles. And I would be the first thing that I saw is, did you try United States? It seemed like the journal you got published in is not in where we are.
Sure thing. It's a great call out, and I appreciate your question. So this is an international journal. It does have a location here in the United States as well. And the title, I understand why that can be confusing because it's States European. The journals that we looked at doing here in the United States, I have a list of them. We were accepted into several. Their impact scores were not high. I wanted to make sure a couple of items were hit. One, the impact score was at least above 4 or 5. Two, it was an open sourced. Again, I want to make sure that this is an accessible article. There is nuances in terms of closed source that might be a little bit more reputable. I want to acknowledge that from an academic space, but also to be quite frank with this team, time was of the essence, and we needed to make sure that we got this publication across the line for the use of this legislation. A couple of the other current national publications would not have met that timeline. So in consideration of both the impact score and the timing, this was the journal we chose. This is the same journal that I published with last year that helped New Mexico, Illinois, and Colorado pass their bills. So that also went in a little bit into the consideration, but this is probably not the last article that we'll publish talking to this initiative. So I'm always open for future collaboration. If you have suggestions, I would love to work with you in that space. Great question. I want to speak a little bit to the methodology. Oh, go ahead, Colleen.
Yeah, I'm talking to myself on mute.
Oh, sorry.
Yeah. Is it possible for Ashley to put this link on the Amputee Coalition, or maybe ask the Academy to, excuse me, the Academy of OMP to put the link, or this is great information. So kudos.
Colleen, this is Ashley. We did share. I think
Okay.
we shared as soon as we saw it pop up. And that we may have reshared AOPA's posting, or we may have reshared directly what Shanice shared, but we will continue to share it.
And let's bring a copy of this to ACPOC and have it on the table.
Happy to do that.
Oh, I'm happy y'all download it too. Yeah, awesome. Sorry.
No sorry needed. Thanks, Colleen. I see Cheryl, you have your hand raised. Go ahead.
Hi, more of a comment than a question, but for those of you who are just getting into your legislation, share this with your bill sponsors, share this with the members of the committee, explain it to them, explain what it means, because you're going to find out that they have no idea what you're talking about. And this is so, so, so important. And so just thanks to Shanice and the team for really putting this together and having this as a resource for all of us. Again, really, really helpful information. And again, just really encouraging everyone to use the information that has been provided and use it as a stepping stone in the conversation starter as you're getting into your legislation.
Thanks, Cheryl. This report wouldn't be what it is today without you. So thank you for all of your collaboration. I see Peter, go for it.
Yeah, real quick. Have we done any writing about the article? Have we put out a press release? Have we drafted something for ONP Edge or things of that nature, Amplitude?
Great question. And it's like you're reading my mind. That is the third resource I have for you. I do work closely with Larry at Amplitude. He did do a great piece on this last month. And he did a great job at explaining at a high level what the findings are. So I'll share this link with y'all as well. But from a press release standpoint, that is not something that I've done. I've been limited to my contacts in the media space. So if you have contacts, Peter, I can certainly work with Ashley at Amputee Coalition and Nicole so everybody can move in general to draft something.
I'm thinking we should do a joint press release of some kind and get that out so people can start writing about this. I would bet you there's a bunch of association newsletters and publications that would take, something that's more digestible than an article. The article's fantastic. You need that published and formal, but to put it in more of a narrative form and something that could easily be picked up by a busy editor that's just trying to get their thing together and has some great content, that could really amplify the breadth of the audience that sees this.
It's a great call out. We need that executive summary, to your point, something that's a little bit more palatable to the general public. So Peter, I love that idea. I'll reach out to Nicole and Ashley. I see your hands raised, Ashley, so let's jump in.
Yeah, I just wanted to emphasize, I know Cheryl kind of leaned in on this a little bit about the the way that this can be used when you're talking with your potential sponsors and champions in your state legislatures. But often there will be like a HERC, or which is a health insurance reform commission, or some kind of commission that your state puts in place. And if you have data like this to get them started, even if they have to do their own analysis, their own fiscal impact report, which many of them will have to do, this is such a great place for them to start. And so it actually will encourage it's like a little jetpack that gives your that gives your legislator just enough, a little bit of a boost, right, to get them into the right headspace. So because they're going to know all these sort of internal functions that and those are things that can weigh down a piece of legislation. There are things that can like put setbacks in the way. And so like Shanice has shared and Cheryl shared, it's an awesome opportunity to sort of say that you're coming with something that can benefit the office of the legislator that's helping you move this forward.
Thanks, Ashley. And I actually have a real world story with Cheryl's team to share about that in a second. But Nicole, I see your hands raised. Go for it.
Yeah, I just wanted to add on to that, to Ashley's point about being a jetpack in a sense for your legislators. I love that analogy. But really, I mean, if your state is not on here as an example, but your state, will be doing a fiscal impact report, I think it's so important for advocates to know that, don't sit in the back seat when it comes to those things. Make sure that you are in the driver's seat on that and providing yourself as a resource, because as we know, orthotics and prosthetics is complicated for billing with L codes. Most of these individuals, the actuaries, have no idea what L codes are. So really, you need to really be in the position of saying, I am actually the expert on this, and I'm going to help to make sure that we drive the fiscal impact assessment and analysis to actually get a number that's realistic. And I think Cheryl has done an incredible job showing, a real life example. Maybe that's what you're going to touch on, Shanice. But I just wanted to get that across to everyone that, this, when a state is doing their fiscal impact report, don't just leave it up to them to do it. You really have to be proactive to make sure it's right for your state.
Yeah, that's exactly what I was about to touch on. I think from a perspective, and I'm apologizing because I didn't really give you any of my background as to how I got into this, but I am a board certified clinician in the field, specifically orthotics. So I have experience from a billable provider perspective. And I have since gone into state leadership, advocacy efforts, and now work in terms of policy reform in a general sense. So I do have a little bit of experience in both worlds, but what Cheryl's example I'm going to give speaks to both of those expertise levels. So Cheryl came in with this report, and her state ended up doing an additional fiscal impact, which is very common, to Ashley's point, and they were very different. And they were mainly different once we dug in a little bit, because they were actually charging the cost of a $60,000 prosthesis for everybody that could potentially need it. This report not only helped us kind of debunk that quickly, but Cheryl actually put in a little extra work on top of it, which was very helpful by giving real world applications. So I think being curious with those fiscal reports that come out in addition to this, and I'm here to help. I'm going to give you all of my information after the fact. And not just from a curiosity standpoint, but also from an expert testimony perspective. This report is complicated, hence the need for some type of press release to really speak to that high level. Don't feel like you're alone. If you want help in that space, I can't always be there via Zoom for scheduling purposes, but I can always submit written testimony, and that's something that I'm here for. So just know that that's available to you. To that point, this report speaks to the cost, which is the slide I have up right now. What the fiscal impact report that your state will also likely do will almost never, and I'm not going to say 100% never, but most likely will never include what the benefit is. And that's what I really want to highlight for you all. So the benefit in terms of what this cost benefit. So like what is the net between the per month per member, which is that cost, versus how much money this type of preventative care will save folks, is in that very last column on the right hand side on an annual basis per state. And so essentially what this means is individuals that get this type of care by the American Heart Association have been studied to save at least $2,500 a year on their own health expenses. And so you take the per month per member total amount per state, and you subtract or find the difference between the 2,500 per person that they're going to save. And that's the amount in that far right column. I'm understanding those values are coming from different pockets, but for your legislators purposes, I want you to highlight that's money that can go back into the economy in other ways. And, you know, at the end of the day, I know we're talking a lot about money, but hey, remember, these are people's lives we're talking about. And that's why your stories are so important to go with this data. Data and real life stories is really what has shown to get this across the line. I know in Colorado, we experienced that. I'm going to pause because I see hands rose. I'm excited. Angela, I think you're first.
Okay, thanks, Shanice. And just, yeah, thank you so much for all the work you've done. Looking at this report gives me some PTSD from last year. So I feel like these numbers, you know, I just mostly wanted to comment on all the work that's been put into this, but to everybody on this call that is new or beginning their process in their state, this is the one tool. This is the one opposition you will get is money, and especially if your state is running at a deficit, like that, your bill will not get passed based on one thing only, and it is a budget line item. So this is the biggest tool you can have. I don't know. My advice would be that, you know, even if your state doesn't require a fiscal impact report, like everybody should conduct one and have this tool in their tool chest, because it is going to be the main opposition. I just can't imagine there being much else to argue about this bill other than money. And the numbers are often false, I think, or, you know, not accurate, or at least not relative to what we can provide. So what Cheryl just did in Maryland was a perfect example of like arguing back and looking at their numbers and then being able to prove to them how there are some inaccuracies and help them along the way. Because like you guys have said, there isn't a lot that's known or understood about our field. So anyway, thank you everyone. And please use this in your states.
Thanks, Ange. Also, I miss you. We used to see each other all the time. And Sean, I saw your actual hand raise and then, you know, your emoji hand. So go for it. Oh, you're on mute. Happens to me every day.
This is awesome. When we tried proposing insurance fairness in Wisconsin a couple of years ago, right, there was a budget standstill and nothing went through. And when this was proposed last year in Wisconsin, the first question is, what's the budget impact? Like, without even listening to a story, it was, what's the budget impact? So I have just wanted some clarification on the O&P population. In general, how do you define that, or how can we best speak to what that means in like really simple, like layman's terms? You
got it. So this report came out of Minnesota's actuarial report that actually got published earlier this year. And why that's important is it's actually one of the most extensive reports that I've seen that's not only done by an actuarial firm, but also outlines their anticipated population in their state. So what I've done is cross-reference US Census Bureau data. Basically, I took, hey, this was Minnesota's general population. This is what they're saying their O&P, you know, prevalence is, and cross-reference that to other states by just, you know, US Census tract information. Yep. There's several other layers that I could go into that's in the methodology of this report, but for layman's terms purposes, I would say this is based off an actuarial analysis, cross-reference with US Census tract data.
Okay. And is it people with limb loss, people that use orthotics and prosthetics?
All of the above. So the Minnesota actuarial report broke out both of those populations. And again, that's why it was so profound. That hasn't been done yet before, to my knowledge, in at least an actuarial term report. And another great fact that Terry actually was able to find in the deep, small citation of the Minnesota actuarial report, they actually referenced Angela and I's report from last year for Colorado. So it's kind of a full circle moment of, hey, you know, us clinicians kind of know what we're doing. And just a little bit more validity in terms of our methods.
Yep. And where could we find this information, or the O&P population estimate for each state? Is that in the report someplace, or is there a link to that?
Yep, so it's in, let's see, image 2 of the report. It's right here in columns H and I. And I want to be careful, it's the device population anticipated. So that report broke it down per device. You could probably assume it's device per patient, but there are going to be instances where, especially in the pediatric space, actuarials probably accounted for a few devices per one patient. So it's not 1 for 1, but it's likely close.
Close. Okay. So great. This is awesome. Thank you. I'll be digging into this.
No problem. And again, to your point, Sean, please dig in, reach out with questions. I'm here to help. I know I'm getting close on my time, Nicole. So I'm going to throw in this link to our Amplitude article that really gives a great overview. And then Peter, I will owe you a follow-up with Ashley, and Nicole will figure out how to do a joint statement.
Sounds great.
Any other questions? I can't say thanks enough. There were so many folks that put their hand in helping me really kind of put it through the cheese grater, which is really important because that's what legislators are going to do. So this was definitely peer reviewed in that sense, and it wouldn't be what it is today without that process. So thanks to everybody that helped.
And thank you, Shanice, so much for your time and effort on this. It's been extensive and appreciated everything that you've done to dig into this and provide this resource for all of the states. This is significant, so thank you so much. All right, keep the agenda moving. We're going to hand it over to Kyle Stepp, who's going to talk about the 28 by 28 Mobility Challenge.
Awesome. Thank you, Nicole. If you don't mind allowing access as well.
Yes.
Sweet. Awesome. Well, everyone, we're excited for this July that we're going to be kicking off an opportunity for us to not only celebrate the successes of all of our different state coalitions, but then also inviting the community to really help fuel this movement towards our ultimate goal, as we all know, to pass the law in 28 states by the LA 28 Paralympics, where we can ultimately really pursue federal reform. And so to do that, really kicking off a really exciting event that's going to be a virtual mobility challenge over the month of July to celebrate disability pride. But really this month-long initiative is really not only for us to celebrate our successes and to raise awareness about the disability rights and why this initiative is so important, but also to invite the community to move alongside us. And so what we're going to be doing is this 28 by 28 mobility challenge is really inviting individuals to create teams, to invite organizations. Organizations can be our state coalitions. They can be our O&P clinics. It could be a group of friends that just want to have some friendly challenges and movement over the course of the month of July. But really, this is where we're going to be asking everyone to sign up and move and dedicate 28 minutes of movement each day for 28 days. And so all kinds of movement counts, whether that is walking, wheeling, dancing, running, swimming. The choice is ultimately yours. And then for us as a community that participate is inviting our friends and our family and our community to donate on your behalf, to really fuel this initiative to the next level. And what does that look like? That's investing in more resources, more infrastructure, and as well as all the additional tools that we hope to invest in you all, is so that you can ultimately accomplish your legislative initiative, but also for us to expand to more states. And then lastly is to invite more advocates, whether they are in your community to join your state coalition or to start a state coalition that we currently don't have in active existence right now. And so we're going to be doing our registration will launch on June 1st. And so over the course of the next few months, really want to invite you all to be a part of helping us spread the word that the 28 by 28 Mobility Challenge will be kicking off July 1st in honor and celebration of Disability Pride Month. But then also, if there's an opportunity, if you're interested in serving as a team captain for your state coalition, whoever that might be, you don't have to necessarily be your state lead or the main lead advocate in your state. But if you just want to be the team captain to rally your members of your coalition, but then also if you're interested in being a team captain, whether it's for your O&P clinic, it's for your company, it's for a group of friends, we'll be sending out a Google form for you to share your interests in being a team captain. And so we can ensure that you have the resources and the tools to ultimately recruit your friends, help your friends fundraise, and to raise awareness. But then also we'll be sending out a Google form if you have organizations or individuals that you think would be great to be a part of this 28 by 28 mobility challenge. You can recommend their name and their contact information, and Nicole and I will be reaching out to them personally. And as well as we'll be looking for sponsors. We're excited that On is returned. On and the Right to Run program has returned to be our title sponsor. Really, so the cool things is not only are they helping fund this initiative, but then also we'll be hooking up individuals with lots of really cool goodies and swag if you ultimately end up being a top fundraiser and participant. So throughout the month of July, we want to make it fun. We really want to elevate what you all are doing, sharing your stories through this initiative, but then also really showing the power of movement and what we can all do together each day. And so we'll have more details come out over the course of the next few months, but we'll be doing a save the date later this month in honor of Limb Loss and Limb Difference Awareness Month. And so we'll be sending out all the details and the marketing materials that you may need in order to get people involved.
Awesome. Thank you so much, Kyle. And just so excited for this month. I think there's a lot of events that might happen or kind of these virtual events in other spaces, but to have one for the disability community in Disability Pride Month for this cause, I think is really special. So we want to get the word out and get as many people in our community to take part in this fundraising and, you know, giving back to the initiative so that we can continue to ramp up the momentum of this. It's been amazing that we've got 35 plus states that are involved. And so we, you know, really need to buckle down and be able to create some resources to help ensure that every state can be successful. So really excited for this, and also excited for all the swag. We're gonna have some great shoes from On. My favorites are the Cloud Monsters. If anyone has tried those before, they're awesome. But also some other groups as well, Cotopaxi bags and other fun giveaways. So it'll be competitive, and hopefully we'll be able to spark some competitive spirit for some competition for fundraising, but also people getting active. So thanks, Kyle, and we'll share that survey or form for people to fill out if you guys are interested in being a team captain or also recommending individuals for that. I also want to shout out in the chat, Shri Thacker, Director of Communications for Amputee Coalition, just dropped in the chat. We should have started off by saying April is Limb Loss and Limb Difference Awareness Month, but excited that we're celebrating that, and the Amputee Coalition has developed some incredible resources for that. So please check out the chat. Shri, I don't know if you want to mention something about that really quick. We can add you into the agenda for a minute. Otherwise, yeah, I see you've unmuted yourself.
I'll keep it really simple. Thanks, Nicole. So the toolkit has a variety of resources, everything from being able to order orange ribbons that this year we updated the design so that way they actually say the words limb loss and limb difference. And that makes them wearable around the year and not limited to April. So feel free to order those. They come in packs of 10 and they'll be available kind of throughout the year. We'll, of course, like revamp stock as necessary. And then, of course, there's a whole communications toolkit on there as well. So you can either share content to your social media platforms and all, because it all connects to All Things So Everybody Can Move. If you have any questions, please feel free to reach out at any time. Of course, I wear all of the hats, being, you know, Virginia's lead, co-lead, as well as the Director of Communications and Partnerships for AC. So that's available for your use. If you have any questions or feedback for us, please let me know anytime.
Awesome. Thanks, Shri. And yes, this is such an important month to get the word out, raise awareness. And I know a number of states have already done proclamations for Limb Loss and Limb Difference Awareness Month, and it's all interconnected in terms of its supporting so everybody can move as well. So thank you, Shri, for that. I also want to share that our website, hopefully you guys can see this, our website is now live for So Everybody Can Move. You can go to soeverybodycanmove.org, and on here you'll have main things I want to kind of point out is our interactive map where you can look at where every state is at in the process. It'll kind of have like a pop-up with if a state has a certain bill or who the legislative sponsors are, and a way to learn more if they have a state page, or for other states that are kind of in the process of building their coalition, a way for individuals to click on our intake form and get involved in that state. And then, of course, one of the biggest items on here is our resources page. So I want to direct you to that. That has our model legislation, our advocacy and lobbying toolkit, a deep dive presentation on the legislation as well, our fact sheets, basically anything that you guys might need to be able to start getting this going in your state. So definitely want to share that in terms of the resources. And if you're a state that has a state page, and you see something that needs to be updated, please reach out to us and let us know about that as well, and we will get that updated for you. So for example, here's Florida's state page, great. So we've had a lot of already great interest and feedback on the website. I'm glad to hear that this has been helpful for you all. And one thing I also wanted to mention and ask if Maddie is on the call, for those of you who need support for your fact sheets, Maddie at AOPA, Maddie McTurnan at AOPA is here to help. So Maddie, I don't know if you want to share a couple words on that.
Okay, I think someone's speaking in the background.
Oh, you're muted.
Can you all hear me now?
Yep, we can hear you.
Because I'm trying to kind of MacGyver my technology here because my headphones died. So I'm Maddie. I work with AOPA as the Membership and Communications Coordinator. And I've worked with a few of you on state fact sheets so far, and they've turned out really well, and they've been useful at, Hill days, advocacy days. So I am very happy to work on a state fact sheet. Just reach out to me. My email is mmcturnan@aopanet.org. And I can tell you if we need to start one from scratch or if we already have one for your state, and we can go from there.
Awesome. Thanks, Maddie. And appreciate you working through multiple technology channels to get onto Zoom. I know how that goes.
Yeah, I promise I'm not on my cell phone.
At first, I wasn't sure. I'm like, wow, you are multitasking. That is impressive. But thank you so much for sharing that. And I know you've already been a big help to a number of states that have needed fact sheets. So appreciate you for that. The other item I wanted to share, in addition to the website, we'll keep this moving along since we're already our calls are now going for an hour and 15 minutes. So we still have got time for state updates, but want to make it quick. The other item is that the Boston Marathon, we're going to be having a panel discussion with para-athletes who are running the marathon to promote So Everybody Can Move. And On Running and Right to Run is our sponsor of that event. It's going to be on Saturday, April 13th at 7 p.m. at Trend Boston in Boston, Massachusetts. And so if any of you guys have friends or individuals that are in the Boston area, I know Maggie, hopefully you'll have a chance to be there or help us get the word out in Massachusetts as well. We're going to have a great panel. I'll be on the panel myself. I'm running the marathon on Patriots Day, Monday, as part of the Boston Marathon. But then we've also got Brian Reynolds, who's a bilateral below knee amputee, incredibly fast runner, professional athlete, sponsored by Brooks, and currently attempting to summit the 7 summits of the world, which is incredibly impressive. We've also got Jackie Hunt Broersma on our panel. If any of you know her, she's the individual that did 104 marathons in 104 days, and she's currently doing something like 250 or 300 half marathons in a row right before leading up to Boston. I'm hoping that she's tapering now because she really has the opportunity to set a world record at the marathon. So I'm really excited to watch her run. And then we've got Liz Willis, who's our 3-time champion at the Boston Marathon and current 10K world record holder that'll be on the panel. And then finally, Miguel Baez, who is a firefighter and kind of first amputee firefighter in Massachusetts. Just has an incredible story and recently got his first running blade, and is working on the So Everybody Can Move bill for Massachusetts in support with Maggie Bomber. So excited for the panel that we're going to have. Please help us get the word out. This is an incredible opportunity to raise up our para community at the Boston Marathon and also to promote So Everybody Can Move. I dropped the link in the chat that you can use to register, and we'll also be sharing on social media. So stay tuned on that and help us get the word out. So thank you all for that. And then last but not least, we will have Sam give a brief update for the AOPA Policy Forum, which is coming up and is at the same time as the Boston Marathon as well.
Yes, thank you, Nicole. For those of you who haven't met me, my name's Sam Miller. I'm AOPA's State and Federal Advocacy Manager, and wanted to share that AOPA's kind of flagship federal advocacy event is coming up on April 15th and 16th. It'll be in Washington, D.C. It's kind of a two-day event. The first day is advocacy education. You'll be learning about AOPA's federal priorities, which right now are is the Medicare Orthotics and Prosthetics Patient-Centered Care Act. This is a bill that was introduced in the House last year and actually was introduced in the Senate just a few weeks ago. And it's essentially intended to ensure access to timely, quality O&P care for folks in the community. And then it also is going to save the Medicare system millions of dollars in fraud prevention. So it's really got something for everybody. And it's this year, it's a very simplified, streamlined bill. So very easy to advocate for, very easy to explain to our legislators. That first day, you'll be learning about the bill. And then the next day, you'll be traveling to Capitol Hill to speak with your legislators and advocate for their support for the bill. We have about 100 registrants right now, and there's, I think, 150 or 60 meetings that are on the books at the moment. So it's quite an event, and we'd love to have y'all involved. I believe, yes, Nicole, thank you. I was about to put that link in the chat, but the registration link is in the chat right now. We'd love to have you join us. It's at the Capitol Hill Marriott, which is just a few blocks away from the Capitol, as you might imagine. But it's a really great venue, and being in DC to champion these causes is a really great time. So we'd love to have y'all join us.
Awesome. Thanks, Sam. All right, now we'll jump into our state updates. We've got quite a few people on the call, so we might have to do kind of speed round. We'll ask that you keep it high level and but also celebrating what you've got going on in your state. So we'll start. For those who are working on the 2024 legislative session for Connecticut, I know Herb had to hop off, but Lindy, are you still on the call?
Yep, I'm here.
Awesome.
So we will have a very short update. So unfortunately, for this session, we fell short. The session we have is short, so only February to May, and the insurance committee didn't feel that we would be successful, so they didn't even want to bring it forth. So you can take us off the list for 2024, and we're going to regroup at the policy forum, hopefully make some good connections there, and come up with a plan for next session.
Awesome. Thank you for the update. I know other states have experienced kind of these short legislative sessions and have had to kind of regroup and look to 2025. So we've got a big list for 2025. We're hoping that'll be a good year. All right. Florida, I think I saw Arlene. Are you still on the call?
Hey there. Yes, I'm here. Thank you so much. And it's so nice to hear everybody's great stories, and congratulations on all the positive work that's happening. We're very much like Lindy. We're going to regroup and come back next year with a different group of folks and try and push it forward next year. We have a very short session, and so we're waiting to finish our current session. We're about a month away before we start our push for next year.
Absolutely. Thank you for that update. And yeah, that's definitely part of the process for many states that, you know, this is sometimes going to take more than a year to get everything in order. All right, is Eric Schotmeyer on the call from Indiana? I'm not sure if I saw him. All right, we'll jump to Massachusetts. Maggie.
Yep, I'm here. Hey, Nicole. Hey, everybody. Yeah, so we had some good news this week. Our bill had been introduced back in the fall, had made it through its first committee, and we were kind of in a holding pattern because it was a late file bill and there was a bit of a backlog. But we just heard yesterday that it finally moved to the second committee, the Joint Committee on Healthcare Financing. There will not be an opportunity for testimony in that committee, but we did send all of our legislators and the folks on the committee this report from Shanice. So thank you so much, Shanice, for that. And we also have a meeting with the Massachusetts Health Plan Association coming up. So the state association used to have a lobbyist. We no longer retain that lobbyist, but he now has the Mass Health Plan Association as a client. And so he was willing and able to kind of broker a conversation between the two of us. So we can preemptively find out what their concerns are. So yeah, our session, we have until July 31st. So we're hoping, and we're hopeful, and we're also optimistic because we've been told that since it was a late file bill and it made it this far, that's a really good sign.
Incredible work, Maggie. And it was really fun watching the Hill Day that you guys had and just the number of people that attended that. Incredible energy.
Thank you. Yeah. And, you mentioned Miguel, he was one of our speakers that day and did such an excellent job. So yeah, it's a really strong group. It's great to be a part of it.
Awesome. Thank you. All right. We've got Cheryl for Maryland.
Hi, everyone. So since our last meeting, I could probably fill you guys in over the next few hours, if not days, on everything that has happened in Maryland. But the short of it is, yes, Kyle, that emoji. The short of it is we had our bill hearings. We've had multiple meetings with Medicaid, commercial payers, etc. Orthotics was completely taken out of our legislation, but Medicaid was kept in. Maryland is facing a over $1 billion deficit this year and counting. And Maryland session is over Monday at midnight. As of now, looks like we're going to have a bill signed. So it's been a journey. I saw Peter, Nina, Rochelle are all on this call. So thank you guys for everything. Kyle, again, it's been a journey. But we both bills were just heard for second reading this morning in the House. After third reading, the Senate bill is done. And because the bills are in the same posture, there's a chance the House bill will get passed as well. So we'll see what happens. Our House sponsor has turned into like a total superstar over the past few weeks. Just all over social media, lots of really amazing stuff. We've gotten some really amazing press coverage as well. I'll put a link in the chat. We had one of our the young boy who testified at our hearing. Him and another young boy were featured at the Orioles game for Limb Loss and Limb Difference Awareness Month earlier this week. So it's been a journey. Anyone who wants to learn more, hear more, happy to share. But again, we're not out of the clear yet. Kyle, I'm telling you, they're going to make us wait. It's not going to. Third reading's not going to happen today. It's just not. But we're it's been a journey. So hoping that we get some really good news by Monday at midnight, because the session ends at midnight, and apparently like confetti falls from the ceiling and everything too. So it's like a thing. So yeah, that's the short version.
Cheryl, you've done incredible work in Maryland. I've seen it firsthand. Can you tell people what the committee members of the Finance Committee and the Health Committee and the Assembly did?
Yeah, absolutely. So our sponsor so in Maryland, again, as you will learn, every state's process is so incredibly different. In Maryland, essentially what happens is a bill is heard on the floor. It's assigned to a committee. The committee has to basically agree to it. It then goes back to the floor where there are 2 votes before it crosses chambers, et cetera, et cetera. What they don't tell you is that if there is a fiscal note involved, there's behind the scenes stuff with other committees. But again, I don't want to take over this call. But essentially what Peter is alluding to is our Senate bill, the entire Senate Finance Committee asked to be added on as co-sponsors for the bill. And our House bill, so our sponsor actually on Wednesday, he announced on the floor to the entire House of Delegates that April's Limb Loss and Limb Difference Awareness Month and to wear orange. And then during the subcommittee voting session on Wednesday, no, yes, no, it was yesterday, Thursday, noticed that at least one of the delegates was actually wearing an orange shirt, which she emailed me after and said it was because of Limb Loss and Limb Difference Awareness Month. But the entire 20 some members of the entire HGO committee asked to be added on as co-sponsors for our House bill. So every single member of the committees is now co-sponsoring our legislation. So bipartisan efforts and support. And then just to go back to what Shanice said, so we got hit with a $15.5 million fiscal note, which we were then able to get revised down to 800,000. So if you do get hit with something high, and 800 is still high, but again, don't need to get into that. But if you are hit with a fiscal note, in Maryland, it is a law that any legislation has to have a fiscal note associated with it. But if you do get hit with a really high fiscal note, just you're not out of the game yet. So these bills have died and come back to life probably at least 5 or 6 times in the past 2 months. So again, it's a journey. It's been exciting, but
let me just quickly say that those members of the committees joined that bill, asked to be co-sponsors for one reason. Everyone loves a success, right? There are many parents to a success, and failure is an orphan, you know, the old expression. So they're all jumping on the ship because they see it sailing.
Yep, they're jumping on the ship. And then the other thing I will say is for those of you working on legislation, whether it goes through this year or not, even if our bills do pass again, we're coming back with orthotics next year. The Podiatry Association in Maryland has said that they're making that their priority next year. So we're already, again, coordinating with other allies. We found so many allies over the past 2 months as well. And all of the payers actually are going to be coming to the office where I work sometime in the next month, so they can actually learn more about O&P. So they're open to, at least, again, you can't say this for everyone, but they're open to learning. And I think that that's really, really valuable. But you are going to be, again, we all live this world in one way or another. So as you get into your legislation, as you're in your legislation, you are going to be very, very surprised at how little a lot of these individuals know about what we're talking about. And they are the ones making the decisions. So don't let them get away with it.
Amazing, Cheryl. I don't think there are words to follow up everything that you just shared. I mean, so many incredible wins of what you've done. Thank you so much for your leadership on this and the team and all the hard work that's been put into this. It's absolutely amazing. All right. So we've got Minnesota and Aaron Holm giving the update.
Greetings all. Yeah, we're in a bit of a holding period pattern, as you know, going from about 100 miles an hour to 0 after making it through committee in March. Waiting on a fiscal note is our understanding for the O&P activity related product. We're optimistic that we get this past this session, pushed into an omnibus bill or included in an omnibus bill or on its own. We don't know yet. Hopefully we will learn more next week. We had some conversations taking place this morning, and we're going to check in with our authors next week. So in March, this is a monthly meeting, right, Nicole, that you hold? So Terry gave an update a month ago.
We've been doing bi-monthly, so last one was in February.
Okay, so I don't know if she mentioned the rally in the Rotunda. That was about mid-month, but we held a rally in the Rotunda in Minnesota on March, I believe it was 13th, which we had about 100 individuals, community members, O&P professionals, attend and kind of educated them and got them involved and engaged with the initiative. Our governor, Tim Walz, spoke and handed over the proclamation for Minnesota, which he does every year, which is fantastic. We've really got to build up a great relationship with him over the years. And then this week we took the proclamation and had copies made, I think about 20 copies we delivered to the community members, O&P professionals, organizations, individuals that are supporting our mission here in Minnesota and our efforts. So requested them just to take some photos with the proclamation of their their clinic and their employees and their people, their patients, and send those off to us to distribute through some social media efforts throughout the month. That's about it from Minnesota, crossing our fingers.
Amazing, amazing work. And, you know, just to put Minnesota in some context, you guys have the most comprehensive bill out of any of the bills that are out there. So what you guys are going for and have raised the bar for many of the states is amazing. And your work, Aaron and Terry Cuffle and Tom and Sam, your lobbyists, have done just a phenomenal job. It was really special to be at the rally at the Rotunda in Minnesota and just see the whole community come together and have Governor Walz speak there. Says a lot about the relationships that you guys have built, and also Aaron, kudos to the work that you've done getting the kids involved at every hearing, you know, front and center at the rally as well. That's such an important part of this, and then we can't forget kind of where this started, as so kids can move, and how important it is to have kids front and center in terms of the narrative and what it brings for legislators when they connect to that.
Well, thank you, and thanks to all the support, everybody on the call that lent us a hand, because it was a little chaotic, but again, whatever we have, we're crossing them.
Yeah, I love it.
Thanks.
Thank you. I love the analogy of going from 100 miles per hour to 0. I think many people who've had bills can relate to that. All right, so we've got Nebraska with Vince.
Here we go. Let's see, when was the last update? Trying to remember when that was. Was
2
that
months
February?
ago in February.
Okay, so it would have been right about when we actually went to legislature. Did I talk about that last month? Or last time? I forgot.
Feel free to give us an update because it's been a little bit.
Yeah. So in February, that was the 13th. So I'm guessing that would have been right after this. We went to the Capitol and we're at our committee hearing. So that was business, commerce, and insurance. And Senator Kavanaugh introduced the bill, and I gave a testimony, just nearly ran out of time, just enough time to sneak in there before they kicked me out. And then had one of my colleagues who wears a prosthesis give his testimony as well. It was interesting having the insurance lobbyists counter us, even though they didn't really have much useful to say. And once the one of the senators on the committee, he pretty much took everything I said, everything Jamie said, and he threw it right back at the lobbyists. And it seemed like they really didn't have anything to go off of. And they pretty much were admitting like, yeah, we're just opposing this on principle. And so like we knew they had to be there. It was kind of funny watching Jamie, like I could see him just like his fists were just balling up as they're talking. It's like, just calm down, this is the process. We haven't had any updates since. Senator Kavanaugh said it went as well as it could. And I've reached out a couple times like, hey, do we need to add any amendments or anything like that? So I'm waiting to see anything. I reached out not too long ago, but it looks like our session ends in a couple of weeks. So there's a good chance it just gets frozen in committee and we just go to try again next year. But we've got a all amputee team set up for our market to market race in September. And we're going to use that to really raise awareness. And been talking to On as well. And there's a chance they're going to provide some support on that end too. So we're looking forward to that.
Awesome. Thank you, Vince, for that update.
Of course.
And I know we're about, yeah, Ashley.
Hey, Vince, would you be able to share some more info about that event you guys have planned? I have a bunch of like family and friends in Lincoln and Omaha that would like love to get involved, I'm sure. And like help out if you guys are looking to build some more coalition.
Yeah, definitely. I'm not personally handling it. There is a separate group here in kind of the Omaha, Lincoln area called AWA, so Amputee Wellness Alliance of the Midlands. So AWA, they're your main group. I know they're on Facebook. They're also called Blade 5K, which is what they started as. There is an event in July or second week of June. It's this summer, but it is a 5K meant to provide activity-specific devices. And I'm teaming up with them, and I asked them if they're okay with me making their nonprofit no longer needed for providing that. And so they're fully behind it and supporting. and they're the ones putting the team together. I'm just kind of supporting. We're gonna have t-shirts made put so everybody can move on there. We're just gonna use that as a platform to really raise some attention. So I don't have any more details on the specific September one, but as that comes out, we can definitely share that.
Cool, thanks.
Awesome. All right, so we're about 5 minutes away from kind of the end of the call, and we're maybe a quarter of the way through our states. So I do want to give time for every state to give their update. If you have to jump off the call, that's obviously fine, but we'll keep kind of moving forward with the idea of, quick, fast updates, hopefully. All right, I didn't see Senator Sue Prentice on the call from New Hampshire. Maggie, I'm not sure if there's anything to share there.
Yeah, just really briefly, the way the New Hampshire legislature works is that there's a crossover. So the bill has been approved through the Senate, and it's April, sometime after the policy forum, I believe, is the crossover date. And so we'll have to wait until then to see introduction in the House side of the legislature. So as soon as that happens, I'll keep you posted.
Awesome. And I didn't see Steve Slawinski on the call from New Jersey, but do you have any update there, Maggie?
Yes, that one is also progressing. It's been reintroduced on both sides of the legislature in 2024 and has gone through a couple of committee hearings. And we're looking into planning a legislative advocacy day at the Capitol in May. So I think on our next call as a group, we'll have more details about that event. So all looking positive, but nothing, hasn't crossed the finish line yet. So we're still working towards it.
Awesome. Thank you. All right. For Ohio, we've got Kaylee and Autumn. If they're still on the call.
Sorry, I was trying to find the unmute
There you
button.
are.
For Ohio, we have, I guess, kind of an update. We have been talking to some hospital systems and some doctors trying to get in with lobbying networks and some medical association lobbying networks. We've also scheduled some more meetings with some more representatives. We recently got a pretty good clarification of how this process looks for Ohio, like specifically, and just like a fun fact that Ohio's session this year is the least productive session since 1955. So we're like, oh, okay, that at least makes sense. But just for like general reference, Ohio session meets once every other week, occasionally, not every month, just once every other week, whenever they want. They don't have a requirement on how many times they are required to meet. So we're kind of fighting an uphill battle on even getting a time when members are in Columbus to do anything. But we're trying to get a co-sponsor still and working on a lobbyist front since timing is so sporadic.
Awesome. Thank you for that. And yeah, it's kind of like it's not me, it's you type of problem with Ohio, but you guys have done an incredible job building your network and laying the foundation. Cheryl, I see you have your hand raised.
Yeah, I was just gonna say, first of all, that sounds insane. So keeping your foot to the pedal. But what I was gonna say is, because they're clearly doing stuff every other week when they're not doing their legislative stuff, maybe take the opportunity to see if that you can invite them out to like an O&P clinic or something, or come to an office to be like, hey, even if we're not talking about our bill, right? Like, we'd love for you to learn more about your constituents who wear prostheses and orthoses, especially during Limb Loss and Limb Difference Awareness Month, blah, blah, blah. So maybe try taking that angle, and that could help you to get a different foot in the door.
Love that. That's a great idea. All right, we've got Randy in Pennsylvania.
Hey, yes, thank you for all your assistance here at PA, and give you an update. Or just like Ohio, it's been very non-productive. They basically took a 2-month hiatus until March 18th in the House. They were saying it was because of broken pipes in the Capitol need to be repaired, but anyway, we'll let that stand where it's at, but we know where it's at. Anyway, so but the legislator here that's would be sponsoring our bill, very receptive. The process has also changed a little bit. Before, they could put like a placeholder on the bill number and hold it, and then once the bill comes to the floor, then it's already has that that bill number. So, but it's changed. Now we have to wait for her to come to the floor with the bill. And then at that point, it'll be given a bill number. So it's interesting to see the turnaround legislature before, just to see the legislation where they were only interested in supporting prosthetics and nothing for orthotics and those for physical activity, and just so everybody can move. And I just the complete flip. It's supportive. So I think once we get this off the ground and get it back here, they won't go out of session until late June. So we have quite a few session days here yet in April, and then May, and then June. And then we have, of course, next fall. So, I feel pretty positive about this. Again, thank you again for Shanice for all the information that you provided to us. Very, very helpful. It's very fluid. It's a very important document that we really needed. So.
Awesome. Thank you, Randy, for the update.
Yeah.
Keep pushing forward. All
For
right.
sure.
And we've got a new state added, Alaska. So I'm excited. If Justine, you're still on the call, would love to hear, not necessarily an update, but whatever you want to share, because I know it's really new for you guys.
Yeah, hey, very excited to be part of this call. I just started learning about this legislation a few months ago. I'm kind of where Danielle was, a very eerily similar story in terms of researching amputation as an option after rock climbing accident. Found this legislation, got in touch with the local group of orthotists and prosthetists, and Allison is on this call. So just a couple of weeks ago, we met with So Everybody Can Move for the first time. And then last week we met as a group in Alaska for the first time. So we're very much in the information gathering, planning phase. And I think once we have some more solid next steps, we'll start our outreach. So this is just really inspiring and gives me a lot of hope and excitement about this effort. So thank you all so much for all the work that you've done. And it's amazing to have so much groundwork already laid out for this project. It's really incredible. So thanks a lot.
Awesome. Yes, thanks, Justine and Allison. Welcome to the team. All right. If Glenn, if you're still on the call from Alabama, another state that we've just added. And I know a lot of people are probably jumping off, so I don't know if I see Glenn anymore.
Nicole, I believe Glenn has left.
Okay, thanks, Maddie. And I didn't see anyone from Arizona or California. Is Krista Lee still on the call? No. Sorry, guys. I know this went over.
I'm here from Georgia.
Okay, Colleen, would you like to give an update
Yeah,
from Georgia?
yeah, we have our committees. I mean, we are just in grassroots thanks to all the help, but we're have our annual Georgia Society, O&P meeting where we're having a table promoting an ACPOC for pediatrics, where we're gonna put a big banner up and everything for you guys. It takes time, and I love hearing everyone's stories. Thank you. It's nice, and I printed the articles. I'm going to share the articles. So I think there's stuff we can do to help support each other.
Awesome. Thank you for that, Colleen. I think that'll be great to have that at ACPOC again. That's been a great partnership. All right, Jen Robinson in North Carolina. Jen, I'm not sure if you're still listening.
Hey, I'm
Oh, there you are.
sorry.
You're good.
I couldn't unmute myself. Hi, everybody. Yeah, so where we are right now is we are trying to nail down a meeting date with Senator Perry. So we did find a champion for this legislation. Actually, he found AOPA up because he had a family member experiencing limb loss. So we have a champion. We are trying to nail down a date, and where we're at right now is sort of just keeping that conversation going until we solidify the actual date, because we have people in the area, advocates who want to meet and share their story. So I was really glad that you shared that that study on the cost of prosthetic care, because that's something that we can give. And so what we're finding, Dana Glover, who I think is still on this call, she's an amazing advocate in North Carolina, and she was able to work with the Amputee Coalition to get a proclamation for limb loss and limb difference awareness month this month. So every time something happens, we use that as like to continue the conversation moving forward. So Dana's going to say, hey, you know, Senator, look at this, you know, this is happening in our area, just to get that date. So that's what we're waiting for.
Awesome.
Yeah.
Thanks, Jen. You guys have done a great job, and exciting that that senator reached out.
Oh yeah.
Personal experience. I think there's definitely something to be leveraged there.
Amazing. And we have an amazing group of advocates that's growing and growing and growing. And we recently went to a support group meeting in the area and got other people involved. So it's just like snowballing, which is awesome. So great to hear what everybody else is doing too.
Yeah, thanks. All right, Ashley for Washington.
Hi, everyone. We have also recently come into a bunch of new folks in our coalition, which is very exciting. The Northwest chapter of the Academy meeting is this week, so we're meeting a lot of folks and talking to a lot of folks and adding some more orthotic users to our team, which we're really excited about. And we've been meeting with some folks from the Insurance Commissioner's Office in Washington to do a lot of prep for 2025. So right now we're still kind of in the building coalition and kind of building up some momentum before we start reaching out to potential sponsors. But we've had a lot of good momentum the last couple of weeks, last month or so. So we're very excited to keep it moving forward.
Woohoo, go Washington. All right, I think that does it for states that are working on legislation. If Francois, Ange, or Kyle, if you want to share anything about the policy implementation work that you guys are doing, feel free to unmute and share. I'll give us a second if you are interested in that.
This is Ange. Kyle and I are working on like an implementation toolkit, but as far as our state specific, I don't have any updates for Colorado, but there is a lot of great work going into implementation in general. That's like the obvious next step as there's all this momentum with states passing. I think that this bill will only be successful if it's actually properly implemented. So I think we're trying to get ahead of the curve there and having a strategic implementation in place before too many more states pass the bill. So I'll just say that as a very high level because I know we're short on time, but I don't know if Kyle, if you want to say anything more specifically. No.
Awesome. Thanks, you two. We're excited for that toolkit. And then Francois.
Yeah, it's I think in Arkansas, since we were one of the first, it's a kind of case by case and practice by practice implementation. We haven't gotten a whole statewide implementation. So it's more individualized. But I do want to congratulate everyone who's being involved and moving forward with all the good work. And you guys that haven't got it past this session, just hang in there and just keep grinding. It will come through.
Absolutely. That's a good way to end the call. Thank you so much, Francois. Oh, sorry. Go ahead, Kyle.
I would just say, I think so far the exciting thing is the 4 patients that have worked with their practitioners to get activity-specific devices haven't had a single denial or have had to go through a complicated process. It's just been very streamlined. So that's a huge win. And then as well as Medicaid in New Mexico approving the coverage as well.
Awesome. It's been amazing to see New Mexico leading the charge on that. Yeah, Colleen.
No, I'm just reflecting back when we first started a year ago or a year and a half ago when I jumped on one of the very beginning calls with Sam. Just look at all the people, all the little squares right now on the screen. I mean, it's Nicole, Ashley, everybody involved, Peter. I mean, it's just amazing just to see the engagement in a very short period of time. So kudos to everybody. I feel like celebrity squares, on TV. So yeah. Thank you, everybody.
It is really cool to see the momentum and just I don't know if I got the highest amount, but at one point we had around 60 plus people on here at the start, which is amazing to see. And we have over 200 advocates that we are inviting to these calls. But really just want to give a kudos to all of our partners, AOPA, NAOP, the Amputee Coalition, and the Academy. really that collaboration at the national level has made this such a success. So we're excited to keep it going and, end this call on a high note that, as Francois mentioned, keep pushing forward, keep grinding, and we're excited to continue to bring the community together on this. And we'll be in touch for our next call. Thanks, everyone.
Thank you. Thank
Thank
you.
you.
Thanks,
Thank
George.
you for all you've done.
Thanks, Randy.
Yep.
See you, everyone.